Healthcare stands as a fundamental pillar supporting societies across the globe. Its significance cannot be overstated. It is absolutely essential for maintaining and improving public health outcomes. Effective healthcare systems are crucial for managing diseases, both chronic and infectious, thereby reducing their societal burden. Furthermore, access to quality healthcare directly contributes to increasing life expectancy for populations. This allows individuals more years of productive and fulfilling life. We see this impact consistently, whether in developed nations or emerging economies. The core mission remains the same: to protect and enhance human health at every stage of life, ensuring that people can live healthier and longer. The influence of healthcare extends deeply into the daily lives of individuals. It profoundly impacts personal well-being and overall quality of life. When people have access to good medical care, they feel more secure and are better able to manage health challenges. This, in turn, boosts the productivity of entire populations. A healthy workforce is a more engaged and efficient workforce. This connection between health and productivity is a critical factor for societal progress. Consider the ripple effect. Healthier children learn better, healthier adults contribute more to their communities and economies, and healthier seniors enjoy more active retirements. This demonstrates healthcare's role in fostering a vibrant and capable society. Beyond individual health, the healthcare industry is a massive contributor to national economies. It plays a significant role in bolstering economic stability. The sector itself generates substantial revenue and contributes significantly to a country's gross domestic product, GDP. This economic contribution comes from various sources. These include hospital services, pharmaceutical sales, medical device manufacturing, and numerous allied health services. Investment in healthcare infrastructure, therefore, is not merely a social expenditure. It is a strategic economic investment that can yield considerable returns in terms of national prosperity and resilience, especially in times of global health crises. Moreover, the healthcare sector is a major source of employment globally. It provides a diverse range of jobs, from highly skilled medical professionals to administrative and support staff. This job creation is vital for economic growth and stability in many regions. Simultaneously, the healthcare industry is a powerful engine driving technological advancements. The constant pursuit of better treatments, more efficient diagnostic tools, and improved patient care models fuels innovation. These innovations often have applications beyond healthcare, contributing to broader technological progress. The dynamism of this sector underscores its dual role as both a guardian of health and a catalyst for economic development worldwide. We are currently witnessing a profound transformation in healthcare, largely driven by digitalization. This digital revolution is reshaping how medical services are delivered and managed across the world. Key technologies such as artificial intelligence, AI, are becoming increasingly integrated into diagnostic processes and treatment planning. Intelligent automation is streamlining administrative tasks, freeing up healthcare professionals to focus more on patient care. Electronic health records, EHRs, are replacing cumbersome paper-based systems, allowing for seamless sharing of patient information among providers. Furthermore, telemedicine and mobile health applications are breaking down geographical barriers, making healthcare more accessible than ever before. These innovations are not just incremental, they represent a fundamental shift in the healthcare paradigm. The benefits of this digital transformation are manifold and significant. One of the most crucial advantages is the enhancement of efficiency across healthcare operations. Digital tools automate routine tasks, reduce paperwork, and optimize workflows, leading to quicker service delivery. This increased efficiency directly translates into improved patient care experiences. For instance, EHRs provide clinicians with comprehensive patient histories at their fingertips, enabling more informed decision-making. Digital diagnostic tools often offer greater accuracy than traditional methods. This focus on leveraging technology ultimately aims to create a healthcare system that is more responsive, precise, and patient-centered, ensuring better health outcomes for all individuals. Another critical aspect of healthcare digitalization is its potential for cost-effectiveness and error reduction. Automated systems can significantly reduce the administrative overhead associated with manual processes. This helps in controlling the escalating costs of healthcare delivery. For example, digital prescribing systems can minimize medication errors, which are a major concern in patient safety. Furthermore, data analytics powered by AI can identify patterns and predict potential health risks. This allows for proactive interventions that can prevent costly complications down the line. By making healthcare more efficient and safer, digitalization contributes to a more sustainable and reliable healthcare ecosystem, benefiting both patients and providers. Globally, digital healthcare is also making a substantial contribution to economic growth. The development and implementation of these new technologies create a plethora of new jobs. These range from software developers and data scientists to technicians specializing in medical equipment. The digital health sector fosters a vibrant ecosystem of innovation, attracting investment and stimulating research and development. This innovative spirit leads to improved productivity not just within healthcare but in related industries as well. As countries invest in digital health infrastructure, they are also investing in a more resilient and future-ready economy. This underscores the dual impact of digital healthcare improving lives and bolstering economic prosperity. For a vast and diverse nation like India, the healthcare sector plays an exceptionally vital role. It is intrinsically linked to the country's economic growth trajectory and the overall public health of its 1.4 billion people. Addressing the healthcare needs of such a large population presents unique challenges and immense opportunities. A robust healthcare system is fundamental for ensuring that citizens are healthy enough to participate fully in economic and social life. As India continues its journey of development, strengthening its healthcare infrastructure, particularly through digital means, becomes paramount. The health of the nation is, quite simply, the wealth of the nation, and this is especially true for India. The Indian healthcare industry holds tremendous potential for creating millions of sustainable jobs. This job creation can span various skill levels, from community health workers to highly specialized medical practitioners and technology experts. Beyond employment, a modernized healthcare system can drastically improve health outcomes across the country. This includes reducing maternal and infant mortality rates, better managing chronic diseases, and effectively tackling infectious disease outbreaks. The economic growth generated by a thriving healthcare sector can be substantial. This encompasses revenue from hospitals, pharmaceuticals, medical devices, and the rapidly expanding field of medical tourism, where India is already a notable player. Digital healthcare solutions offer a powerful pathway for India to bridge existing gaps in healthcare delivery. One of the most significant challenges is ensuring equitable access to quality care, especially in remote and rural areas. Technologies like telemedicine can connect patients in underserved regions with specialist doctors in urban centers. Mobile health apps can provide essential health information and support self-management of chronic conditions. Electronic health records can improve the continuity of care even when patients move between different providers. These digital tools are not just conveniences, they are essential enablers for making quality healthcare a reality for every Indian citizen, regardless of their geographical location or socio-economic status. Furthermore, digitalization can play a crucial role in making healthcare more affordable and accessible in India. By improving efficiency and reducing administrative burdens, digital systems can help lower the overall cost of healthcare services. For instance, AI-powered diagnostic tools can provide faster and more cost-effective screening for certain conditions. Online pharmacies and digital platforms can improve the transparency and accessibility of medicines. Government initiatives promoting digital health, such as the Ayushman Bharat Digital Mission, are steps in the right direction. These efforts aim to create a national digital health ecosystem that empowers patients and providers alike, ultimately making healthcare more patient-centric, cost-effective, and universally accessible throughout the nation. Medical coding is a critical yet often overlooked component of the modern healthcare ecosystem. In simple terms, it is the process of translating complex medical diagnoses, procedures, services, and equipment into universal alphanumeric codes. Think of it as a specialized language that healthcare providers, insurance companies, and public health organizations use to communicate effectively. Coders meticulously review patient records and assign specific codes for every aspect of a patient's encounter. This standardized information is then used for a multitude of purposes, from billing patients and insurers to tracking disease prevalence and conducting vital medical research. Without accurate medical coding, the entire healthcare system would struggle to function efficiently and transparently. The importance of medical coding cannot be stressed enough, particularly when it comes to the financial and administrative aspects of healthcare. Accurate coding is absolutely essential for generating precise medical bills. It ensures that healthcare providers are appropriately reimbursed for the services they render. Insurance companies rely heavily on these codes to process claims and determine coverage. Beyond billing, medical coding plays a pivotal role in data management. The coded data forms the backbone of health information systems, allowing for the collection, analysis, and interpretation of vast amounts of patient information. This data is invaluable for healthcare organizations to monitor quality of care, manage resources, and make informed strategic decisions. The global medical coding market is experiencing significant growth, reflecting its increasing importance. According to recent market analysis from February 2025, the market was valued at approximately $27.84 billion in 2023. Projections indicate that it is set to expand considerably, reaching an estimated $49.87 billion by the year 2030. This represents a compound annual growth rate, CAGR, of around 10.4% between 2024 and 2030. Such robust growth underscores the rising demand for skilled medical coders and advanced coding technologies worldwide. This expansion is a clear indicator of the industry's recognition of coding's central role in efficient healthcare operations and data integrity. Several key factors are driving this impressive growth in the medical coding market. The sheer volume of patient data being generated is increasing exponentially, necessitating sophisticated systems for its management and analysis. There is also a growing global emphasis on the need for standardized coding systems to ensure consistency and comparability of health data across different regions and providers. Furthermore, the world's aging population and the increasing prevalence of chronic diseases mean more healthcare interactions and, consequently, a greater need for coding services. Insurance companies are also demanding greater accuracy in claims submissions, further fueling the demand for precise medical coding practices. Section 5. The American Blueprint: Lessons from Widespread Medical Coding Adoption. The United States offers a compelling case study in the widespread adoption and integration of medical coding within its healthcare system. Medical coding has gained significant traction across the American healthcare landscape over several decades. It is now considered an indispensable part of healthcare administration and revenue cycle management. This high level of adoption is not accidental, but rather a result of specific systemic factors and regulatory pressures. Healthcare providers, from large hospital networks to small private practices, rely heavily on accurate medical coding to navigate the complexities of the American healthcare environment. The US experience provides valuable insights for other nations looking to strengthen their own healthcare information systems. Several key drivers have contributed to the robust uptake of medical coding in the USA. One primary factor is the critical need for accurate billing in a predominantly insurance-based healthcare system. The process of seeking reimbursement from numerous private and public payers is incredibly complex. Standardized codes like ICD-10, International Classification of Diseases, 10th Revision, and CPT, current procedural terminology, provide a common language. This allows for consistent documentation and billing for services rendered. Without this standardization, the billing process would be chaotic and inefficient, leading to significant financial challenges for healthcare providers and confusion for patients navigating their insurance benefits. Regulatory mandates have also played a crucial role in cementing the importance of medical coding in the American system. Landmark legislation such as the Health Insurance Portability and Accountability Act, HIPAA of 1996, established standards for electronic healthcare transactions and code sets. More recently, the Affordable Care Act, ACA, introduced further reforms that emphasized data collection and quality reporting, both of which rely heavily on accurate coding. These governmental regulations have created a strong impetus for healthcare organizations to invest in robust coding practices and skilled coding professionals. compliance with these mandates is not just a matter of good practice, it is a legal necessity. Finally, the sheer scale of healthcare expenditure in the United States underscores the necessity for efficient and accurate medical coding. The US spends a significantly larger portion of its GDP on healthcare compared to most other developed nations. This high level of spending necessitates meticulous tracking and justification of costs. Medical coding provides the detailed data required for financial oversight, resource allocation, and health economic analyses. It helps in identifying areas of high cost, understanding utilization patterns, and evaluating the effectiveness of different treatments and interventions. In an environment of such substantial financial flows, precise coding is essential for accountability and sustainability. Section 6. India's coding conundrum, understanding the adoption lag. In stark contrast to the widespread adoption seen in the United States, medical coding in India has experienced a notably slower pace of growth and integration. While the potential benefits are immense, the practice has not yet gained similar traction across the Indian healthcare landscape. Many healthcare facilities, particularly smaller clinics and hospitals, still rely on rudimentary or non-standardized methods for recording patient information and billing. This disparity in adoption rates highlights a significant opportunity for improvement and modernization within India's health information management systems. Understanding the reasons behind this lag is crucial for formulating effective strategies to accelerate its uptake. One of the primary reasons for the slower adoption of medical coding in India is a general lack of awareness. This applies to both the healthcare providers and the wider public. Many medical practitioners may not fully appreciate the benefits that standardized coding can bring to their practice, such as improved billing accuracy, better patient data management, and enhanced research capabilities. There is often a perception that coding is an additional administrative burden rather than a valuable tool for efficiency and quality improvement. Furthermore, public awareness regarding the importance of accurate health records and the role of coding in ensuring data integrity is relatively low, leading to less demand for such systems from the patient side. Another significant challenge lies in the area of training and skill development. Medical coding requires specialized knowledge and skills to accurately interpret medical documentation and assign the correct codes. Currently, there is an inadequate infrastructure for comprehensive and standardized medical coding training programs across India. This results in a shortage of qualified coding professionals who can meet the growing demands of the healthcare sector. While some private institutions offer training, the quality and curriculum can vary. A nationally recognized certification and robust training ecosystem are essential to build a skilled workforce capable of supporting widespread coding adoption. Beyond awareness and training, several other barriers impede the progress of medical coding in India. The initial cost of implementing coding software and systems, along with training staff, can be prohibitive for many smaller healthcare providers. Existing healthcare infrastructure, particularly in rural and semi-urban areas, may lack the necessary technological capabilities to support digital coding platforms. Furthermore, India's healthcare system is quite fragmented, with a mix of public and private providers and varying levels of technological sophistication. This fragmentation makes it challenging to implement a unified approach to medical coding adoption across the entire sector, unlike the more centralized mandates seen in countries like the USA. Section 7. Balancing national priorities. Healthcare in the Indian context. The Indian government has historically demonstrated a strong commitment to advancing sectors perceived as crucial for national prestige and strategic advantage. Fields like space exploration and defense technology have often received significant attention and investment. These sectors typically showcase India's technological prowess on the global stage and are seen as vital for national security and sovereignty. Achievements in these areas, such as successful satellite launches or advancements in military hardware, often generate widespread public pride and international recognition. This focused approach has undoubtedly yielded remarkable successes in these high-profile domains, positioning India as a key player in these specialized fields. This prioritization of space and military sectors often translates into tangible benefits that are visible and can have immediate strategic or economic implications. For instance, advancements in space technology can improve communication networks, weather forecasting and resource management, directly impacting various aspects of the economy and daily life. Similarly, a strong defense sector is considered essential for maintaining geopolitical stability and protecting national interests. The clear, often measurable outcomes from investments in these areas make them attractive priorities for government focus and resource allocation. This strategic emphasis is understandable given India's ambitions and its complex geopolitical environment. However, this concentrated focus on certain high-visibility sectors can sometimes lead to other critical areas, such as healthcare, receiving comparatively less sustained attention and investment. While healthcare is universally acknowledged as important, its benefits are often more diffuse and long-term, making it less politically glamorous than a new rocket launch or a defense acquisition. Consequently, public healthcare infrastructure, particularly in a vast and diverse country like India, may not always receive the consistent level of funding and strategic focus it truly warrants. This can create disparities in the quality and accessibility of care, especially when compared to the rapid advancements seen in other prioritized sectors. The result of this relative underinvestment in healthcare, particularly in its foundational infrastructure and digital solutions, can be significant. It can lead to slower adoption of modern healthcare management practices, including essential tools like comprehensive medical coding systems. While India has made strides in certain aspects of healthcare, such as pharmaceuticals and medical tourism, the systemic integration of digital technologies across the public and private health landscape remains a work in progress. A more balanced approach to national priorities, one that elevates healthcare investment to a level commensurate with its societal and economic importance, is crucial for India's long-term well-being and development. Section 8. Illuminating the path forward. Raising awareness for a digital health future. To accelerate the adoption of digital healthcare solutions, including medical coding, robust government initiatives are absolutely essential in India. The government plays a pivotal role in setting the national agenda and creating an enabling environment for change. This involves not just formulating policies, but also actively promoting the benefits of digitalization throughout the healthcare ecosystem. Initiatives could include financial incentives for healthcare providers to adopt digital tools, development of national standards for health information exchange, and investment in public digital health infrastructure. Strong leadership and a clear vision from the government can significantly drive the momentum needed for a nationwide digital health transformation. Alongside government action, comprehensive public awareness campaigns are critical. These campaigns need to effectively communicate the tangible benefits of digital healthcare and medical coding to both healthcare professionals and the general public. For providers, the message should focus on how these tools can improve efficiency, reduce errors, enhance patient care, and simplify administrative tasks. For the public, the emphasis should be on how digital health can lead to better access to care, more personalized treatment, greater transparency, and empowerment in managing their own health. When people understand the why, they are more likely to embrace the how. Various strategies can be employed to raise public awareness effectively. Media campaigns utilizing television, radio, print, and social media can reach a broad audience with clear and concise information. Community outreach programs involving local health workers and community leaders can address specific concerns and build trust at the grassroots level. Highlighting success stories and tangible benefits, such as how telemedicine has saved lives in remote areas or how EHRs have improved patient safety, can make the advantages of digital health more relatable. Educational programs in schools and colleges can also foster a culture of digital health literacy from a young age, preparing the next generation for a digitally enabled healthcare future. Crucially, supportive policies are needed to underpin these awareness efforts and drive tangible change. Government policies should actively incentivize healthcare providers, especially small and medium-sized practices, to adopt medical coding and other digital health tools. This could involve subsidies for software acquisition, grants for training programs, or performance-based incentives linked to digital adoption. Furthermore, policies should support the development of a skilled workforce by investing in training programs for medical coding professionals and other digital health skills. A combination of push-through mandates where appropriate and pull-through incentives and education will be most effective in fostering widespread adoption. Section 9. Unlocking India's potential, charting the course for medical coding success. A fundamental step towards realizing India's digital health potential, particularly in medical coding, is a significant increase in government funding and investment. This investment needs to be directed towards strengthening healthcare infrastructure, especially digital health initiatives. This includes building robust IT backbones in hospitals and clinics, ensuring reliable internet connectivity, and promoting the development and adoption of interoperable health information systems. Prioritizing financial resources for these foundational elements will create a fertile ground for medical coding and other digital health solutions to flourish, ultimately benefiting the entire population with improved healthcare access and quality. Implementing clear and supportive policies is equally crucial. The government should consider policies that either mandate or strongly incentivize the use of standardized medical coding systems across all healthcare providers, both public and private. This would ensure consistency in data collection and reporting, which is vital for effective health system management and research. Financial incentives, such as subsidies or tax benefits, can be particularly helpful for small to mid-sized healthcare providers to offset the initial costs of adopting medical coding solutions and training their staff. Such measures would significantly lower the barrier to entry and encourage wider participation in the digital health ecosystem. Enhancing nationwide training programs is paramount to build the necessary technical expertise in medical coding and other digital health technologies. These programs should be standardized, accessible, and aligned with international best practices to ensure a high-quality workforce. Recent developments, such as Revelir, a value-based care platform, opening a global capability center in Chennai in March 2025, highlight the potential. This center aims to leverage India's talent pool for operations, including medical coding, product development, and quality assurance. Scaling up such initiatives and ensuring robust certification mechanisms will create a pipeline of skilled professionals ready to drive India's medical coding sector forward. Finally, fostering collaboration and partnerships will be key to accelerating progress. Encouraging private sector participation and forging strong public-private partnerships can bring innovation, investment, and expertise into the healthcare sector. Collaboration with global healthcare companies can also facilitate the transfer of advanced technologies and best practices to India. By taking these concerted steps, increasing investment, implementing supportive policies, building a skilled workforce, and fostering collaboration, India can successfully unlock the vast potential of medical coding. This will not only streamline its healthcare system, but also position the nation as a significant player in the global digital health landscape, paving the way for a healthier and more prosperous future.